I'm going to see a live button show up. I still see pre-live. Are we live?
We are live.
So we can proceed with the program.
Yes.
Excellent. Well, good morning, everyone. Thanks for joining this this exercise, more than an exercise, I guess. Live from Snohomish County, it's Wednesday morning. My name is Matt Smith, and I'm the Director of Industry Development for Economic Alliance Snohomish County, which, if you're not aware of us, we're a private nonprofit countywide chamber of commerce and also an economic development organization. We wanted to work with Impact Washington to bring this event to you because it's more than timely, it's more or less essential. So we'll jump right into things here. C19, as I call it, instead of COVID or Corona, C19 has caused all of us individually to be aware of personal protection. As the economy takes a step or two forward to reopen for business, protection in the workplace is a common topic, and in some unfortunate cases, Costco seems to be a current example. It's a subject of media coverage if you're not doing it right. So having a plan to prepare your manufacturing facility to restart and developing new or improving old processes is essential to getting your employees back to work and meeting the needs of your customer. So Economic Alliance and Snohomish County, jointly with Impact Washington, are hosting 2 online meetings targeted to Snohomish County manufacturers. Today, you're with the Wednesday, May 13 event. It will also be repeated on Monday, May 18th at 11 a.m. Impact Washington experts will share their guidance on recovery and preparation best practices. So during this presentation, you're going to learn about preventative process measures, as well as commonly overlooked areas in your facility that you will want to address: break room, restrooms, other areas. Additionally, one of the main reasons we wanted to host this event with Impact Washington is that the presentation will also cover how you as a manufacturer can get a 100% paid, as in no fee to you, assessment of how do you improve your processes and how do you roll out safety measures. Impact Washington has been through this process before. They have the expertise. The idea is not to have you reinvent the wheel. And of course, it's free. So I've yet to meet a local firm that included virus responses in their planning process over the past few years. The new environment now makes this a prudent step, and today's webinar is a start. So as also hosting today's call, or your subject matter expert, I'm pleased to hand off to one of my partners at Impact Washington, Steve Winters, who is the Regional Account Executive for our geography for Impact Washington. My compliments to Steve and his team for handling the logistics and pulling all of this together. Questions can be submitted at any time using the chat function at the bottom of the screen. And if you don't have access or you're listening on phone, you can also email those questions in for response at a later date. And that goes to swinters, as in Steve Winters, at impactwashington.org. This meeting is being recorded, so if you go to the Impact Washington site, you can listen to it again later. And I guess I've said enough. It's time to turn it over to the expert. So Steve, please take over.
Thank you, Matt, and good morning, everyone. Thank you for joining us. Before I tell you about Impact Washington and why are we doing this, we're putting these webinars all over the state through the economic development councils and private firms, and all have essentially the same content. So if you know of other companies, please spread the word to your partners, suppliers, clients, if you feel it might be useful for them. Impact Washington is a 501c3 nonprofit. Next slide, please. We are part of the MEP National Network, and we provide Washington manufacturers with enhanced growth, reduced cost, and provide workforce training and empowerment. And generally, we're on a mission to expand manufacturing competency and capacity throughout the state. The Washington Impact Washington is part of the MEP National Network. You can see that there are 51 of us, one in each state and one in Puerto Rico. And we are this state's manufacturers extension partnership. So we've been around for over 20 years and have helped Washington manufacturing community with retained jobs, increased revenue, and lower cost. And this is based on surveys by a third party. We come from the manufacturing world as owners, executives, operations managers, and engineers. We've been directly engaged with production operations, so we've dealt with many of the challenges our clients face and have direct experience with the impact these services provide. We, along with our large network of resource partners, are offering support to manufacturers in this time of uncertainty related to COVID-19, providing no-cost guidance and recovery preparedness for continuing or returning to operations. The Economic Alliance, Snohomish County, and Impact Washington are reaching out to the manufacturing community to offer assistance to enable you to continue to return to work safely and with confidence. Just an overview of the presentation is, so we're going to look at high-level steps for each site and facility and how you can comply with those guidances. We want to talk about best practices and housekeeping recommendations, employer risk, how to classify worker exposure, and implement workplace controls. We want to expose the risk and how do you apply that risk to take safety measures. So NIST MEP centers received a grant from the CARES Act funding for pandemic response. And I would like to thank our legislators, congressmen, for supporting the MEP system throughout the United States. We want to assist manufacturers in this time of uncertainty so that they can resume normal operations, and very importantly, to protect the workforce. It's important that your workers are safe, but it's also important that your workers feel safe. We want to be sensitive to the needs and challenges of managers and owners, and we want to provide counsel and advice using systematic procedures based on best available information. We realize at this time that the guidance documents keep changing, and so we're keeping up with the OSHA guidelines and CDC guidelines. 3 high-level steps for site compliance. That's review, conduct, and implement. We want to review your existing procedures and comment on facility best practices. And we want to conduct an employer risk assessment based on people's position in the facility and their risk exposure. And then we want to implement. We want to work with the employers to assist in the implementation of workplace controls and best practices to minimize risk of exposure. If we go through the review portion, this is where Impact Washington will focus their efforts initially. We want to, next slide, we want to assist in developing facility-wide communication plan and employee support and training. Again, we want your employees to be safe, but we also want them to feel safe. We encourage employers to recognize areas and practices which pose a risk for spreading the virus. We want to encourage people to do health screening through best practices and recommendations, and establish guidelines and train all employees and visitors on COVID-19 related procedures, and then limit non-essential visitors from entering the facility. We want to create social distancing, which can be done with procedures or with engineering controls. We'll talk more about that shortly. And then just good health habits. Sometimes we find it helpful to install signage as needed to remind employees of good health and safety policies. Next slide. Other best practices tailored to individual sites. We look at each individual facility uniquely and make recommendations based on the practices that are already in place and what would minimize the exposure. We want to look at entrances, hallways, and common spaces. We want to remove door closures where possible and keep doors open to allow employees to move between doorways without touching the knobs. Employee clock in and clock out practices. We want to provide additional sanitizer, for example, near the time clock. Any common tools where you've got multiple individuals using the same tools, things like keyboards, buttons, those should be sanitized between users. Standard tools like brooms, rakes, scrapers, or hand tools should be sanitized after each use. And then look at shift change. If there's some things that you can do administratively to minimize risks, such as stagger shifts, staggered days, shift changes, breaks, lunches, to avoid people grouping together. Order Santa cans with sinks that provide outside tables for additional break areas. And then with some employees working remotely, determine if any office space can be repurposed for segregating lunch and shift changes. And then meals, breaks, things of that nature, expand and stagger breaks and meal times. Intensify sanitation of things like refrigerator handles and sinks, microwaves, and then additional considerations, visitor training, cybersecurity. You want to limit the non-essential visitors from entering your facility. This includes other employees that are not usually stationed in a different location. And then cybersecurity provisions. We're starting to see a lot of cybersecurity threats because hackers are now taking advantage of offsite employees who do not have adequate cybersecurity. Next slide. So to help employers determine appropriate precaution, OSHA has divided job tasks into 4 levels: low, medium, high, and very high. Normally, high and very high are generally considered medical staff or first responders. Most manufacturing workers will fall into the medium or lower exposure risk categories. So OSHA looks at 3 code requirements for workplace safety. The General Duty Clause says employer has the duty to create a workplace that's free from risk and hazards to the degree possible. And then bloodborne pathogens written toward healthcare and first responders, but can bloodborne pathogens be transferred through bodily fluids, through your employees? And then PPE, having the appropriate PPE for risks in the workplace. And we do a risk assessment for each workstation. And then conduct. We want to conduct a high-level compliance. We will make recommendations, workplace evaluation based on exposure risk for specific operations. As I said, we will look at each workstation and determine the risk and how can we minimize the risk to your employees. It could be things like engineering controls, ventilation, barriers, physical layout to minimize any kinds of contact. You've seen at the grocery stores that put plexiglass shields between the cashiers and the customers. That might be an option as an engineering control. You want to evaluate separation surfaces to prevent cross communication of breathing air and consider implementing barriers to ensure 6-foot minimum separation, and consider implementing barriers to ensure that there's no cross-contamination. And then administering controls such as best practices and procedures, staggering breaks, staggering clocking in and clocking out. Those are administrative type controls. And then where possible, use PPE as appropriate for the employee's conditions. Next slide. So this is an example of a risk assessment worksheet that looks at mitigating risk. So we look at each individual workstation and what are their job duties and how can we place workplace controls based on the risk of exposure. Next. So next steps. If you're interested in having a no-cost COVID-19 assessment, please contact Impact Washington. That's at impactwashington.org. And then we will set up an appointment, ask you a few questions, and then find one of our consultants that will take anywhere from a half day to a full day to do an assessment. We're doing video chats of tours of facilities so that we don't enter your facility. We're still under a stay-at-home order by the governor. So we have to minimize that exposure, both to your employees and to our consultants. So many times we will do a video chat and then we go through a survey of 25 questions that asks what policies and procedures you have in place and then make recommendations based on that. Next slide. Next. Okay. So at the beginning of the COVID-19 crisis, Impact Washington was involved with the Department of Commerce, the Governor's Office, and others serving as a matchmaker to identify critical needs and to mobilize manufacturers to produce risks. It's very encouraging that we've seen a number of manufacturers have tooled up to make PPE, and now the FMEA has established PPP Exchanges that are simple to use and connect private sector sellers with private sector buyers. By the way, this recording will be available on our websites and on the Economic Alliance of Snohomish County on their website as well. So if you need these websites. There's also the Amazon Business, and Amazon.com is another exchange platform for PPE. Next. So feel free to reach out to Impact Washington and the Snohomish County EDC websites. If you're watching from out of state or listening, please email us and tell us which state you are in, and we will connect you with your MEP in your state. We'd like to open it up for questions at this point, and we have received questions from previous webinars, and one of the questions was, we're using PPE, masks, and gloves in our facility as a strong recommendation. Are we required to do this for essential businesses? We hear several different things. So the answer that we have given employers is, unless you use PPE as required based on the level of OSHA risk, mandatory PPE shouldn't be needed. Again, this is one of the advantages of performing an assessment by an outside party. This information can be given to your employees, to your customers, to any government agency. And as part of the service agreement, we sign a non-disclosure clause that says we will not share this information with anyone. I had one client that asked me if we found an L&I issue, would we turn the employer in? I said, absolutely not. This is private information and we will keep that confidential. Matt, do we have any other questions at this point?
I'm not seeing any new ones. I think we can keep on going with some of the questions that have been asked in the past, just because they're very general and they apply to most scenarios.
Thank you. So, cloth mask, any tips for employees to launder easily and between daily uses? So L&I hasn't given any guidelines to us to this date, but dipping a mask in boiling water and drying it, just drip drying it, has been a good method for most employers. OSHA has issued guidelines for the N95 mask, but not the normal cloth mask. So another question that came up, safety committee and shift meetings, we do them monthly. Self-training is an option, but we need group discussions as well. How do we get employees to be serious about this required training in a time of social distancing, especially where other managers see risks in meetings? So communication is always an issue, and then mandatory training with sign-off verification is one method. You can do video conferencing as well to keep people separated. As I said, the most effective way to influence behavior is to set clear expectations and to provide clear feedback. We've run into some clients that some of the employees think that the COVID-19 is just a hoax, and they shouldn't have to be taking these precautions. And I think employers have to just set an example, lead by example, and then make it very clear what the expectations are, and if necessary, take disciplinary action as needed to make sure that the employees comply. It says, are you able to conduct the assessment of a facility if it's operating? Yes, we will do video sharing and send video footage of the workstation and the work areas during the assessment. And to what extent does Impact Washington consultation go into detail? Additionally, can you assess high clearance level facilities? The detail includes the area and the specific employee position assessments. We look at each workstation to include recommendations based on engineering, administrative, and PPE required. Site health awareness and recommendations are also included. High clearance levels facilities can be discussed in a virtual assessment if it's possible. We certainly don't want to get into a situation where top secret information is compromised.
Hey, Steve, I've got a question that's kind of popped up here.
Okay.
And how specific to an industry can these assessments be? And the best, one example is in the world of medical device or biotechnology. In addition to all the other standards and requirements, those firms operate under some, I guess, sanitary requirements that come out of FDA. So when you're doing your work, if you're going through say a device facility, can you incorporate in your recommendations something that might be specific to an FDA requirement?
Yes, absolutely. We look at each individual facility, look at the practices that are in place now, and make recommendations based on the CDC guidelines and the FEMA guidelines and the National Institute of Health guidelines. So many facilities that are making medical devices already have many of these practices in place. And as we look at each individual workstation, we will make recommendations based on the risk associated, that low, medium, high, and very high risk.
Got it.
Any other questions?
Yeah, address again, how is this being paid for? Since the companies aren't paying any fees to Impact.
Yeah, good question. So this is a no-cost assessment that is being provided for by the economic restart legislation that has been passed by the federal government. And we received a grant in order to perform these assessments. And so it's just it's a service that we're providing to companies that wish to do this. Just about every company that we've run into has and done an assessment has learned something. It's always good to have another set of eyes, look at the controls and procedures that you have in place, and then make recommendations. We had one employer that had a palm scan to clock in and clock out. And so you put your whole hand into the time clock, and they had not put any controls on cleansing and sanitizing that between users. So that was one of the recommendations that we made. So many times you think that you've got everything under control, but you may have missed something.
So if there's, you will give the companies your assessment. Do you also make recommendations, or can you give them some referrals if they say, well, how do I actually execute? Who can I get to install these shields? Or it's just something that I don't feel qualified to do myself?
Yes, absolutely. We've got a lot of connections throughout the state of Washington, and many times we get questions from clients, and I always say, well, I sometimes don't have the answer to the question, but I do know who does. So we're able to put the experts. We've got a large number of resource partners and organizations such as the Economic Development Councils, some of the colleges. We can generally find a resource for whatever issue the client comes up with.
Got it. Is this the assessment? Is there some kind of an accepted standard? Is this a recognized industry certification, or is this simply Impact Washington that issues this?
No, these are based on the CDC guidelines, the OSHA guidelines, and the National Institute for Health guidelines. And we recognize the fact that these guidelines are changing almost on a daily basis. So we continue to update our survey questionnaire based on those updated guidelines. It's certainly, we think that a lot of these processes and procedures are going to be required for quite some time. And it will probably change the way some companies do business from now on.
Okay. John would like to know, relative to face shields, can they be cleaned, or at some point you just need to recycle them and replace them?
No, those can be cleaned and sanitized. You don't want to use abrasive cloth, generally things like microfiber, soft cloth, because those face shields get scratched pretty easily. There are other means of sanitizing them as well, including putting them under UV light. There are some companies that are using UV light to sanitize and kill the bacteria or germs on tools and things of that nature that are being used by multiple individuals.
Got it. Since your earlier comment was about not just being safe, but make the employees feel like they're safe, I'm assuming there's value for the companies to let their employees know that they're going through this process. So is this document something that you would publish or recommend that it's hanging on the wall somewhere so that the employees can say, oh, look what my company is doing to protect me?
Absolutely. This can be shared with your employees again. Just not only do you want them to be safe, but know that the company is taking every measure that they can so that the employees feel safe. Some employees may feel reluctant to come back to work because of possible exposure. But if you're doing all of the possible things to make your employees safe with good health and safety practices, good housekeeping, at least it will minimize the exposure of risk. And again, we look at what is the level of risk of the employee and what are the measures that we can take both administratively and engineering wise and giving them PPE.
Is there any guidance to companies? I mean, in the world of healthcare and HIPAA, everybody considers their personal health information to be confidential and not to be shared. Is there anything about that that carries over into these on-site, not assessments, but you take somebody's temperature when they walk in the door, or you do something else that's specific to an individual? Does that need to be protected, or there's HIPAA is not an issue for that kind of stuff?
It certainly is, and there's some gray areas there, and some employers are struggling with that very situation. Many of our clients have started using the no-touch thermometers and taking everyone's temperature as they enter the building. And there's a question in the survey that says, do you ask your employees if they have taken any medication such as aspirin or Tylenol to minimize any fever that they may have? Some employees feel like that's invasive and is violating their rights to privacy. So it is a touchy subject, but we really encourage people to, first of all, take people's temperature on the way in the door. And then if they are taking some medication, that the employee would be open to sharing that. And one of our clients asked a question a couple of days ago that the employee called in sick and was not feeling well and was vomiting, and then wanted to come back to work the next day and said, well, I had food poisoning. So do you take the employee's word for that, or do you have them get a note from their doctor that says they've been examined and they are safe to come back to work? And that was our recommendation, is if you have an employee that's out sick for any reason, that they get a doctor's note that says they've been released to come back to work.
Got it. Back to the question about the face shields. There's a question being asked. Do you know what spectrum the UV light would need to be to do its job, and the time it would take to disinfect the shield?
I think it's very rapid, and boy, that's a good question. I would have to get one of our experts. If you can email me that question, I will find out the answer for that.
Great. And then a comment from Deloitte, who is the Center Director for Impact Washington. If you've been listening to the news, there are guidances coming out of the state, out of Olympia and elsewhere, relative to the back to work. And this certainly applies to non-essential manufacturing. I heard this morning that that's in process. So Deloitte's statement is that as soon as they get additional or updated or changed information from the governor's office, they will circle back with the companies that have taken on this assessment and make sure they have the latest and most correct information. Thanks, Deloitte.
Yeah, absolutely. And this situation is really fluid. It's changing, like I said, daily and sometimes even hourly. So we try to keep up with all the latest information and then also pass that along to our clients. Got
it. Well, I've got a message here that you will be getting an email from the person that asked the question about the UV spectrum. So check your inbox, Steve.
Yeah, great, thank you.
You bet. we're at 11:35. We don't want to keep people any longer than is valuable to them. So one last call for questions. Anybody else have something they want to put forward? Here's a question. This is from me. Is being out of work due to the C-19? I assume that there are no issues. Is that an L&I claim? How does L&I deal with COVID-19?
If you're out of work and you don't have COVID-19?
No, if you're not working because you've been diagnosed with COVID-19, I'm assuming that's not considered a workplace injury, but if you were contacted or you can make the case that the reason you have C-19 is because you picked up the bug in your workplace, does an employer have a liability, and or is that then back to being a workplace injury because it happened in the office?
Well, that's a good question. I would have to ask Kevin Proctor, our HR expert. And again, if you could shoot that question to me on an email, we'll get a response to you.
Got it. Okay, I've got no new questions in the inbox. I want to thank all of you for participating. As we said earlier, this session is recorded, so if you want to come back and go through it again, please do. The session will also be repeated live from Snohomish County next Monday at 11 a.m. So if you have employees that you'd like to listen to this, or if you have manufacturing colleagues, we ask that you spread the word around because we'd like to maximize the distribution of this information. So Steve, unless you have anything else that you want to publish or volunteer, I guess I would say thank you to everyone and go out and make it a good day. Thank you all for joining. You bet.
Thank you, Matt, for hosting this, and we'll do it again next Monday.
Thank you.
Thank
Bye-bye.
you. Bye-bye.